Assalamu alaikum. Today we have discussed an important topic of ENT, which is Bell's palsy. I have to discuss this topic according to your exam pattern. So in your exam pattern in NUMS, we have to discuss this topic according to your MCQs, short essay questions, and examiner's viva questions. So in this topic, I have to discuss more focus on the more important and basic point of this disease, like in Bell's palsy, so you are able to solve the MCQs, short essay questions, and examiners viva questions. So we have to start this topic. In Bell palsy, the most common a nerve involved in this disease is the facial nerve paralysis in Bell's palsy. Basically, there is a compression of the facial nerve in the facial canal. So you have to know about the exact area of their compression. In facial canal there is a compression of the facial nerve, so it will cause the symptoms of facial nerve lesions. So first you have to know about their branches. So what are their branches? Their branches are temporal, zygomatic, buccal, and mandibular and cervical nerve. So these are their branches. So in short essay questions you have to ask about their branches, so you know about their branches, and in MCQs as well. And also you know about their presentation. In Bell's palsy, the presentation is always acute in onset. Acute means sudden onset. There is no time to, they have to develop, so they have only just a sudden presentation. And their presentation is always unilateral. Unilateral mean they involve the one side, like they have only affected the left, so their presentation are on the left side. If they are on the right side though, so their lesions presentation are on the right side. And what are their causes? The most important causes are there. The first cause are their unknown etiology. There are no any significant cause that causes facial nerve paralysis, but according to the some studies, they says the herpes simplex virus are the most common cause that causes facial nerve paralysis in Bell palsy. And these are also an important MCQs point, like what are the condition that Bell's palsy are more common. So more common in pregnancy, these are also in MCQs, and also asked in short essay questions, and like examiner also ask these questions in viva. The more important features of Bell palsy and facial nerve are the facial nerve features. Like when the facial nerve paralysis have occurred, so what are their features? So first features are lower motor neuron lesion. So there are two types of lesion. One is upper motor neuron lesion, and second one is lower motor neuron lesion. The difference between upper and lower motor neuron lesion is, in lower motor neuron lesion forehead is affected, so you have to differentiating point. So in upper motor neuron lesion they not affected the forehead. So second point is loss of taste, like in anterior two-third of tongue is affected. Dry eyes, like the parasympathetic fiber which supply the lacrimal gland are also affected, so dry eyes. In hyperacusis, like the patient feel or heard the louder sound as a compared to normal intensity sound, like the sound is of normal intensity but the patient feel louder sound. And orbicularis oculi muscle which is also paralyzed, so patient is unable to blink or close the eyelid. And one of the most important is muscles of facial expression are most commonly affected. So these are the journal features which are always asked in short essay questions, and also asked by the examiner in exams. I have to also discuss their treatment. So in most of the examination they were not asked the treatment plan, but I have to discuss, like steroid is the mainstay of the treatment, like prednisolone dose is 1 mg per kg, and antiviral is started like acyclovir 800 mg TDS will give the patient. And the most important point is their prognosis is very good. Patient have improve all these symptoms, so the prognosis is very good regarding the Bell's palsy. So I have to discuss this topic, like the most important points of the Bell palsy. Inshallah you will read this lecture, and you will able to answer the all the MCQs, short essay questions, and examiners viva questions. Thank you.